weekly Wednesday short health spaces. Again, this space will be only going for 30 minutes. We will end sharp at 2 p.m. And welcome to our weekly space. And I'm here with Dr. Kumar. Hi, Dr. Kumar. How are you?
Hi, Tanya. How you doing? Good to see you.
Good to see you too. I'm doing great. Actually, I was reading up on. Let me go ahead and pin the article up here that is going to cover the subject matter. Okay, there we go. I pinned some of the references so that it's going to be part of the YouTube too. So when we finish live streaming on YouTube, I'll include these articles on here. So, Dr. Kumar, why don't you go ahead and let's talk about this? I've been studying light therapy for a long time.
Yep.
And I know it's something that you utilize quite a bit as part of an add-on for all your therapy that you work with.
Yeah, absolutely. So, Tanya, this is something that I kind of stumbled upon when I went to learn acupuncture at Harvard Medical School. So, we had a couple of days that was dedicated exclusively to what is called photobiomodulation. It's also called PBM, photobiomodulation. I know it sounds like a complicated phrase, but what it is basically using light therapy to help in various medical issues. And specifically, we're talking about what we call as near infrared and far infrared. So, this entire science of photobiomodulation was actually born at Harvard Medical School through a physician called Dr. Hamblin, Hamblin. And if you go look at the literature on this, there are tons of articles that have been written by him, tons of information and research that has been done by him. And it's more or less kind of getting into mainstream medicine, but not there yet. So the reason that I'm doing this call and giving this information out, I think, is to bring awareness to the people that such a thing exists. But more than that is to kind of jump into the details and the nuances of how many kind of issues that this particular field of medicine can help out. So let's start from the beginning. So visible light, which is VIBGYOR, right? So you have the red light at one end of the spectrum, and we measure red light based on what we call a wavelength. So visible part of the red light is around 700, what we call nanometers, really, really tiny. So just above that, a little bit more is what is called near infrared, and beyond that is far infrared. And if you continue to increase the wavelength, then you're getting into radio waves, FM, and AM. Right. So when we use infrared light, whether it's near infrared and far infrared, it has some huge biological effects in the human being. So, what is that particular biological effect? So, energy production occurs in the mitochondria across the board, right? So, when oxygen is being utilized to create this energy molecule called ATP, we need a particular enzyme called cytochrome oxidase C. And that enzyme is critical to create that last phosphate molecule onto this ADP molecule to create that ATP. Now, ATP is the currency of energy in our body. So when we age, when we have medical issues, the mitochondria are the first ones that get hurt. And so ATP production falls because of the effect of everything that's going on this enzyme called cytochrome oxidase C. So the only way to jumpstart, or one of the main ways of jumpstarting this enzyme to kick it into action, is by exposing that enzyme to red light, infrared light, and red light. So exposure to that will jumpstart the cytochrome oxidase C. Now the production of ATP is a lot more efficient. "Quote unquote," you have more energy running around in the body. Not only that, it helps increase blood circulation, increase nitric oxide production, a whole host of healing properties that will kick off just because you have energy available for utilization in the body, which means your immune system can rev up, your recovery from physical injury revs up. So there are a whole slew of things that happen because of unlocking of the production of ATP. So where is this applied? I've had at least three Major League Baseball players calling us specifically for using whole body red light therapy. And what are they looking for? They're basically looking to recover quickly from any kind of injuries that they've gone through. And the ones that they were really looking for is what's called whole body photobiomodulation. And the machine that we have in our Palm Beach Gardens office is manufactured by a company called Novothor. Plenty of information on novothor.com. People come in for about 18, 20 minutes, lie down. So the red light and the near infrared light goes from both in the front and the back of the body, expose as much of the skin as possible, and that's it. So the only time that we will discourage patients from getting onto this bed is, women who are pregnant or think they're pregnant, because we don't know what that effect is on the growing fetus, and that's the first contraindication. Second contraindication is somebody who is sensitive to light. It's what's called photosensitive. That could be a whole bunch of medical issues like systemic lupus, or it could be exposure to some kind of medications that makes them more susceptible to burn from light. So those are the exceptions that we generally do not encourage patients to get on this bed. But otherwise, so people can go look at a video on YouTube where Olympic athletes have actually bragged about how they were able to score some major points during the Olympic Games in Brazil, a few years ago. So if you search for Novotor Olympic athletes, you get about a 5-10 minute video of testimonials from these athletes, and it's really impressive. The reason I got involved in with this technology was when I hurt my foot, and I was able to recover what would have taken 3 months within about 4 weeks. So I was driving back and forth to Fort Lauderdale for a 15-20 minute session twice a week for a couple of weeks. And I think it made a big difference in how quickly my fracture healed. What are the side effects? Absolutely nothing. No side effects. I told you about the exceptions that we don't let people come in, but otherwise anybody can jump on and jump off this particular situation. So this is for whole body photobiomodulation therapy. So where else can you use this? So we can use it in the anti-aging arena. You can use it for patients with systemic illness like fibromyalgia, chronic fatigue syndrome, again, as an add-on to anything else that's going on in your life, whether it's cardiac issues, mental health issues, whatever. I think it makes a big difference, basically by jump-starting the energy production in your body. So that's as far as whole body is concerned. Now, you can also use a handheld device to use the same spectrum of red light to treat localized pain. For example, knee pain, you take it back pain. So when I do this procedure along with my acupuncture, the results are just phenomenal. So you can also use it. I mean, this morning we had a patient with peripheral neuropathy affecting the feet, and she could really see and experience, that life is beginning to flow back into the feet. I mean, I don't think I've seen anything else that can produce this kind of a quick response. And where is that from? It's basically coming from increased blood supply to that area that has been deprived of blood for God knows how long. So that's on the musculoskeletal area. The other area is in brain rejuvenation. So there is a physician called Margaret Nazer. She's at Boston Medical School, and she's done tons of research along with Dr. Hamblin on photobiomodulation in the brain. So, massive results in patients who have had traumatic brain injury. It comes in a form of a helmet. The only company that I know of who's manufacturing that is a company called V-Light. They're based out of Canada. It's kind of expensive, but I think if people can invest a couple of $1,000s, starting at the age of 50 or so, I think you'll probably see some benefits kicking in. So there are studies ongoing right now, and how this may have a beneficial effect on preventing Alzheimer's disease and other forms of dementia. I mean, I've been using V-Light for the past 6 years, 20 minutes a day. Do I see any changes? I mean, I'm doing so many other things, so I don't know what is, but it is what it is. I just feel good. So that's in the brain photobiomodulation area. Where else can we use this? Again, as an adjuvant, we can pull this up for any kind of issues. So, for example, a lot of our cancer patients come in for radiation and they develop what's called mucositis, which means burning in the mouth and the throat when you're treating them for head and neck cancers. Using red light kind of flashed on that area in the mouth will have a major impact in terms of healing in that area. So the need for pain medicines really goes down. The other area that I found some major changes are those patients with burns, skin burns. Way back in 2017, I had a woman who came in like in the 40s. She came in with second and third degree burns of her face because of an explosion of an airboat engine. She was taken down to Tampa General Hospital, given a shot of morphine, cleaned up, and told to come back in a few weeks for skin repair and stuff like that. So she called me, or her husband called us, desperately seeking help with medical cannabis to help her pain. Now, in 2017, it used to take us a couple of months for us to get anybody to get the license for the medical cannabis. So anyway, we brought her in, and I used the handheld laser like for 5 minutes a day, not knowing if this was going to do anything. And I can tell you, it was stunning. The results were stunning. 3 or 4 sessions, the skin was completely healed to the point where a month later she goes back to Tampa General Hospital for the skin repair. And what's there to repair? Everything is healed. Nothing. So I gave her tons of literature from PubMed, with Dr. Ham's name on it, on how a low-level laser therapy or photobiomodulation can help heal anybody with the burns, any degree of burns. And apparently, the surgeon looked at it, threw it away into the trash can, and walked away. So there we go. But she still swears to how effective this particular process is to help those with burns. In my opinion, I think every burns unit in the country or in the world should have a unit, either whole body photobiomodulation or at least a handheld device. It is worth it. So
'Cause
that's
I
about it.
remember when I had my NAD infusion, and then when I was done, I laid in the
Yeah.
and it really helped. I didn't. I mean, it was like, I mean, NAD already was giving me my boost already, but I can feel the difference with or without it.
So Tanya, basically you nailed two things. Okay. So when we talk about the currency of energy in our body, we have two units of currency. One is our ATP and one is our NAD, right? So NAD production is with direct infusion of NAD IV, right? But the way to jumpstart your ATP is this red light, the whole body. So now you have two sources of energy. Can you imagine? I mean, you're going to be unstoppable with that amount of energy that's going on inside you, not only to help heal, but also to take you down to your next level, physically, mentally, emotionally, you name it, across the board. I mean, I get on that bed every chance I get, at least 3 or 4 times a week. So, along with our NAD infusion, at least once a month. I mean, that's what you will do, and that's what I do. But it's been phenomenal. For me, as an oncologist, this has made such a huge difference in the way I practice medicine. It's been more than 4 years since I wrote up more than 2 prescriptions of pain medicines in 5 years. And I used to be the biggest prescriber for fentanyl in my cancer center, at least 5 to 10 prescriptions a day for over 20 years, or Percocet and Oxycontins and so on and so forth. In the past 4 years, maybe 2 prescriptions have gone out from my office. Everybody gets red light or acupuncture or any of the other things. It's a simple way of doing it. absolutely minimal side effects, if any. Yes, it does take some time, energy to come to the office and get the right thing done because it is a medical device. Having said that, there's tons of red light devices that are coming up on Amazon for you name it. They're talking about facial rejuvenation, acne treatment, and blah blah blah, whatever. I don't know how much of that is legit. I have no clue. I mean, you can buy something for a $20 thing. I'm sure you and I can get together in a garage and make, buy some red light bulbs from Home Depot and sell it for a few bucks more. I mean,
But
so I,
nowadays it's really hard to get people change their way of thinking because the mentality is if I don't feel high off of this, especially if they're suffering with some pain and they don't have any energy and they're low, and they're like in between their prescription and they don't realize that they have no testosterone because anyone that's on pain medicine usually don't have testosterone because there was like a whole study on that on one of those pain med. They were talking about how hormone replacement is so important for people who are going through pain management because it does deplete the hormones. So with that in mind, and then utilizing the photobiomodulation therapy, I it just makes more sense when you get a doctor to understand the full function of the body and not just like give you a band-aid and hopefully you feel better the next day or two, or just continue taking that band-aid, putting the band-aid on you and not really actually figuring out why you feel bad all the time.
yeah, no, I mean the thing is this. So even if you do it as a band aid, but if a band aid can be put on with absolutely no side effects, maybe not do it every day or every week. Even if you do it once a month, it's still worth it because the changes are noticeable and the changes are amazing. It is something that people will recognize the moment they get off that bed. For me, when I get off that bed, I feel like super duper man, ready to fly. So anyway, that's my experience. So if somebody's interested, if you're in the Palm Beach area, again, Novator, if you go on their website, they have a list of providers around the country. So I'm sure you can lock into, one of those providers and get the help that you need. At least give it a shot.
And also, while we're talking about light therapy, do you find that is it like I'm talking about back in 2005, I bought this light and it's supposed to like you're supposed to use it during the winter time, and turn it on, and it made me so hyper. Like I sat in front of it, but I didn't realize you're not supposed to sit in front of it too long. But it made me
Yeah.
really hyper. I mean, light therapy is intense. Like if you don't know what you're doing.
Hey, Tanya, you just took me back, a couple of decades. So when I first came to this country, I came in December into Chicago, like 5 feet of snow, and never saw sun for more than a few weeks. Guess what? Depression city. And that's where exposure to this visible light will change. So it's called some kind of an affective disorder because basically lack of light. So once you kind of expose your eyes to visible light, which means kind of mimicking sunlight, your body will adjust to that new reality. So because not seeing sun for days to weeks is not good for health. So that's a different aspect of light. So I think photobiomodulation in this area, we are basically referring to, and I'm strictly sticking to the red light area. So the visible red light and the invisible red light. So a lot of people come into me and say, "Oh, I have a red light lamp. Do you think it works?" The problem is, I think it does, but more than that, I think the therapeutic benefits are in the near infrared and the far infrared light, and those are not visible. Understand? Visibility of light stops at the edge of the red light in that spectrum. So over that, when the wavelength increases to near infrared, infrared is something that you cannot see. So when I have my handheld device on, you see both the red light and bands on it that are dark. It's the dark bands that are invisible infrared light. So the red light just tells me where the beam is going in, but the therapeutic benefits is actually coming from the invisible part of that beam that's coming out of the machine. So people need to be aware, because there's a lot of hype, a lot of BS information that's going around. Again, this is strongly supported by science. You just have to know the questions that you need to ask and go to the right place to get the right answer.
Isn't it this just in the last year or so? I think there's a lot of more clinical study for photobiomodulation.
I'm so glad you asked, because one of the things, remember with the COVID situation that was going on, they found, again, this is still experimental, this is still under study, that the amount of lung damage that was occurring in these COVID patients was basically helped with the use of whole body photobiomodulation. The problem is, how do you transfer a patient who is so sick, with his lung issues from COVID onto a Novothor bed or a red light bed? I think so. There are physical challenges to it, but the point is, it's something that we need to think about going forward. At least, so what can it do? At least boost the immune system at a minimum. And not only that, the other thing is, this is something that I forgot to mention. It actually helps mobilize the stem cells in our body because of the increased circulation. So that's the added benefit. So when you're looking at the actual healing part from red light, I think it's partly not only the increase in energy, but also the mobilization of stem cells in the body, so that now they can go in and stick to areas that need help and start the repair process. So having said that, the last thing that I would like people to know is there is a fabric that's available from a company called firmaware.com, firmawear.com. And if you go on that website, there's tons of research on using a particular kind of fabric, with research coming out of Dr. Hamblin from MIT and Harvard Medical School. When you put on that fabric takes on the body heat and converts that into far infrared heat and pushes it back into your body. So I have a pair of these, t-shirts. Again, it's part of my life. I just wear it no matter what. But this is something, if somebody has chronic fatigue syndrome or chronic pain, and you name it, it doesn't matter what the pain is from, just putting on these fabrics, you may feel a difference. Again, it's not a band-aid, it's something that we wear clothes anyway, just put that on. So I encouraged my patient this morning with the neuropathy of the feet to buy a couple of socks from that company and just wear it and see where it goes. So this is infrared therapy at home, using a fabric. Now, how much easier can it get?
Don't they come in like sheets too? You can get them sheets to go with your bed.
Yeah, yeah, yeah. So there are sheets available, there are pillows available. They're actually hanging these array of red light that they're putting out. I think some of the health clubs may have it, um, but I'm not sure how effective they are. I mean, they look good. Again, make sure when we're talking about infrared or photobiomodulation, I'm not looking at the heat aspect of it. We're actually using those wavelength light to go in and clear up the problems associated with that enzyme, cytochrome oxidase C. So there is a difference between using heat that people use in saunas, compared to red light therapy. I think that should take away some of the confusion that exists with the use of quote unquote red light therapy up in these health clubs and so on and so forth, or even for home use. So I'd be a little bit careful and I'd be a little bit skeptical.
I mean, like if you really think about what it's all good for, especially with someone who has diabetes. I mean, like how many people in America has diabetes now? At the rate we're going, it's a very common condition.
Yeah. And can you imagine? So the thing is this: you can imagine this, the complications associated with diabetes. What is the main complication? It's basically the reduced, peripheral vascular disease, right? So it encourages plaque formation, reduced blood supply, reduced energy utilization, the whole yard. So again, photobiomodulation is not the alternative to regular treatment for your diabetes, but it's a complement. You can add that to anything else, and that goes across the board under any medical condition. Adding red light therapy to anything that you guys are already doing will help. Definitely help. It will not hinder, for sure. So the benefits are definitely there. The key here is accessibility, cost, knowing what to do, making sure you're getting the right kind of care that you need, and so on and so forth. So as long as people are aware of that, you can really utilize this technology. Don't let this pass by. At a minimum, again, I have no business connections with firmware.com, so this is not a promo to them. I'm just saying that there are very few companies that manufacture this fabric, and it's a good idea to at least go look at their website and get educated and make your own decisions.
Well, it's
All
that
right.
time
Any
again.
questions?
Yeah, any questions out there, Bob, Legion? You guys might have any question? We have about 1:56. We're gonna shut down in 4 minutes. Hi, Brent. You have any questions? Grab the mic. No, we're all good. Okay. Thank you, Dr. Kimar.
Awesome.
Again, I'm live streaming this. I'll see you next week, and I appreciate you for sharing this. And I'll make sure our references are included in the YouTube live stream.
Awesome. Thank you, Tanya. Take care.
Take care, everybody. Have a great day. Bye.
Bye.